Welcome everyone to this webinar on using behaviour as a tool for assessment and management of feline arthritis, which has very kindly been sponsored by Zoetis. It's absolutely fantastic to see so many of you joining us for this session. Because some of you may not have attended one of our sessions before, I'll just give you a few tips to get the most out of this session today. So if you click on the Resources tab, you will find a CPD certificate, a copy of the presentation slides, and also some great useful information on Silencia, and also actually a really handy pain checklist which you can print off and use in practice as well. So please do have a look in there. They will remain available after the session finishes today, so you can do that now or you can come back later because they will remain available the whole time. We are recording the session, so please don't worry if you miss anything. It will all be available to watch again very soon after we finish today. There will be time for questions at the end. To ask a question, all you need to do is find the chat box, which is at the bottom of your screen, and type away your question. You can do this at any point during the session, so don't be shy. Just type it in there as you think of something. So we are, of course, absolutely delighted that Zoetis have sponsored this session and that Dr. Margaret Gruen has agreed to present on behaviour and pain in cats. Now, Dr. Gruen is board certified by the American College of Veterinary Behaviourists and has a particular interest in pain in cats with degenerative joint disease and how it impacts behaviour. So, of course, she's absolutely the perfect person to present to us on this topic today. So, without further ado, over to Dr. Gruen.
Hi, I'm Margaret Gruen. I am a veterinary behaviorist and an assistant professor of behavioral medicine at North Carolina State University College of Veterinary Medicine. I am going to talk to you today about one of my favorite topics, which are behavioral signs of degenerative joint disease and arthritis in cats. And I'm really grateful to Zoetis and to ISFM for having me here today. These are my disclosures, so groups that I have worked with in the past 3 years. And this goes through what we're going to cover today. So we're going to talk a little bit about osteoarthritis and degenerative joint disease as a multidisciplinary condition. So how this affects cats who come to us with multiple problems. We're going to talk a lot about the behaviors that are affected by OA pain and why that matters, why OA pain is so important to be able to assess and to manage for quality of life. And then we'll talk a little bit about what's in the future for treatment for these cats. So first, to really ground us in what we're talking about, pain is a very multidimensional condition, and it is a uniquely individual experience. The way that each of us experiences pain will be different from one another, and there are many components to that pain experience. So the one that we will often focus on is that physiologic one. Where does the pain come from? Where does it hurt? How long has it been going on? When did it begin? What's causing it? Something about the sensory. So what's the intensity of the pain? What's the quality? When does it hurt? What's the pattern? But more and more, we're starting to focus on these other dimensions. So the emotional one. What are the effects of pain on mood and on anxiety, on overall well-being? On coping styles, so that cognitive piece, both cognitive functioning, which may be impaired by chronic pain, but also an animal's approach to that pain, their ability to cope, will affect that pain experience. The family, the environment that the animal, human, dog, cat is in will affect that pain experience. And then we're certainly focusing more and more on these behavioral pieces. So how that affects physical activity, how that affects different pain behaviors. And we're learning more and more about how it affects sleep and sleep patterns. So when pain is chronic, it has downstream consequences. So what we're looking at here on the right is a normal stimulus intensity curve. So we have our stimulus intensity along the x-axis, our pain intensity along the y-axis, and in blue we have the normal pain response. So as the stimulus becomes more intense, it starts to become painful, and that pain intensity increases as the stimulus intensity increases. When we have chronic pain, we have a shifting of that curve to the left. So now if we follow the curve in red, we have stimuli that were not perceived as painful before that are now rated as painful. That's allodynia. And then stimuli that were rated as painful before are now rated at a higher pain intensity. So hyperalgesia. So an amping up of the whole system. And this can lead to changes that are reflective of defensive behavior, right? Don't do that. Don't touch me. That's going to hurt. I know that's going to hurt, which is a component of learned avoidance. So making sure to avoid those situations or those activities where an animal anticipates something will be painful. And this is also indicative of peripheral and central sensitization. So even distal to the joint that actually has disease, an animal will be more sensitive overall. And this really complicates our management of our patients, this cycle of sensitization and pain and stress. When we see this in our hospitalized patients, we can certainly see this amping up of the system, right? So as we have pain that affects rest, we see more guarded movements, right? It makes it harder for us to evaluate our patients. Tense, tight muscles. This can then lead to weakening of the muscles. When we have fear and anxiety, we will see more stress and we'll see more pain. So things are rated as more painful when animals are fearful, until obviously you get to a point where they're so fearful that they've kind of gone into that learned helplessness state. We'll see changes in mood, changes in sociability, sleep impairment, which then leads to fatigue, which then leads to more pain. So this cycle can become very difficult for us to manage, especially in the hospital. Because what we start to see in the hospital are these animals who have decreased coping. So they'll have increased fear and increased avoidance, and it makes it much more difficult for us to assess them. So with cats, who are kind of difficult to assess anyway, we now have this more inhibited behavior. We can have tightened muscles that are associated with fear and discomfort, but also become then associated with being in our hospital. So those tightened muscles, that pain becomes associated with being in the clinic with us. And then those animals become even more fearful of coming back in, right? When we think about that learned avoidance of places where things are painful, if you're uncomfortable and now you're stressed and you're tightened up and things are more tense and uncomfortable, that place becomes associated with more avoidance. We'll see them animals be more tense, more nervous, and vigilant. So this is one of these great pictures. This is a very common kind of cat that we'll see in the clinic, right? Where they are not outwardly aggressive or fractious, but are clearly uncomfortable. So call them bread box or meatloaf cats, where they just sit in a little ball tucked up in, looking away perhaps, but their ears are forward. You know they're listening to you and watching for everything. So they're really anxious, and it makes them much harder for us to really evaluate. And it's important for us to be able to evaluate them because osteoarthritis and degenerative joint disease are part of one of the things that we'll commonly see in older cats. It's a multidisciplinary condition. These are our multidisciplinary cats. We have to approach them from many different angles. So when we think just about OA, we have to think about their pain management. We have to think about how we manage their behavior, how we manage their environment to make things more comfortable for them. And then we have to think about all their other needs, their needs for coming in, for seeing us, for primary care, for internal medicine. But our patients often don't come to us with just one problem, right? It's not just the OA. They also may have chronic kidney disease. I'll show a slide in a second that shows the high overlap of chronic kidney disease and OA. They might have hypertrophic cardiomyopathy. They might have diabetes. They rarely come to us with just one problem. So this is data from a study that was done at NC State that looked at that overlap between degenerative joint disease and chronic kidney disease. And what I want you to focus on here is this degenerative joint disease group. So she looked at the percentage of cats who had chronic kidney disease, who had small kidneys only on radiographs, or who were classified as CKD negative. What you can see is that of the 128 cats who were evaluated, 68, almost 69% of them had chronic kidney disease. So the overlap between these two diseases is quite high, which is important for us in thinking about how we manage and treat these cases. So that prevalence of painful OA is remarkably high. In middle-aged and older cats, 61 to 92% of cats will show radiographic evidence of DJD. And that range is because of how you define that radiographic evidence, how you pick your cats that you're evaluating. But regardless, that's a really high number. So many of our cats, particularly over the age of 10, will at least have radiographic signs of DJD. About half of those will have clinical signs of degenerative joint disease, meaning that somewhere around 40% of all cats will have degenerative joint disease and associated pain. If you think about how many cats in your practice you're treating for OA or degenerative joint disease, imagine that population over 10 years and what percentage of them are being managed for DJD. It's probably way less than that 61 to 92%. And in part, that's because we'll miss those signs of feline OA. We can overlook those signs of degenerative joint disease, chronic pain in cats. And there's several reasons for that. So one is that most cats don't exhibit lameness as a classical sign. You will certainly see it. I'll show you some videos where we see it. But often they develop bilateral disease. And so what we see is a slowing down or a stopping of doing activities. And that'll sometimes get chalked up to cats just being old and it not really being appreciated that those changes could be due to a painful disease. They tend to be less demonstrative about pain as a protective mechanism. People will say that cats hide pain. We'll talk a little bit about why that might be. I don't think it's so much that they hide pain as that we weren't as good at looking at it, and they kind of aren't babies about it, right? So they just don't, they aren't as outwardly demonstrative of that pain. Cats will compensate for severe disease because they're small and they're agile. And I'll show you a lot of videos of the types of behaviors that we're looking for. It's not that they stop doing them, it's that they start doing them differently. And that's what we need people to be looking for. It's not that they completely stop jumping, it's changes in the way that they jump that are indicative of that painful disease. And the radiographic signs that we see are pretty variable. So cats with pretty early disease can be very painful, but show no radiographic changes. It complicates the diagnosis to have that overlap between the radiographic signs and what we're seeing clinically. Because of that, behavior is the single best way to assess for the presence and progression of pain. Understanding the behaviors that we're looking for, understanding the behaviors that change and the behaviors that we can track is the best way for us to be able to manage these cats and to assess them, right? They can't fill out a pain scale themselves. They can't tell us where they are. Sometimes it's difficult for us to interpret what the radiographs mean. So we really have to be focusing on that cat's behavior and what they're telling us. Because painful OA affects cat behavior in ways that we now can understand and appreciate and look for. So we know that some of the signs that we'll see are in activities like jumping. So jumping up, we might see them taking small jumps up rather than one big leap up. And there'll even be changes in how that one leap up goes. They may play less or sleep more, and changes in the way they play. Again, we'll see a video of this where instead of leaping in the air, they may still play, but they don't jump up anymore. They lay on their side while they play. Jumping down changes, so they may be more hesitant to jump down from heights. They may reach way down. They may make smaller jumps down rather than one single jump down and out. And then we'll see changes in how they go upstairs. Again, these are pretty classic changes that we and our owners can be looking for in their cats. We do see some changes in gait. Again, lameness is not a classic sign, but changes in gait may occur. Certainly changes in overall activity. Their ability to maneuver, that kind of slinkiness, that smoothness we think about with cats, that decreases. We lose that fluidity of movement. We see changes in the way that they perform their activities of daily living. And then we may see changes in their behavior, so decreased sociability, hiding, changes in their mood, their demeanor, and their tolerance of handling. So I'm going to show you a video of a cat and some of the behaviors that we see. And I want you to be thinking about, what do you see in this cat in this interaction? This is Ursa. She's the best cat in the world. Okay, so what did you see? We saw some hesitation, right? Here, we'll watch it again. So we see some hesitation to jump up. Right, we see kind of winding up, a little false start, and then see how she doesn't clear the jump with her back legs. She makes it there, right? She is still up on the couch, but the way she does it is different, and that's what people need to be looking for. If we get to the point where we have the absence of behaviors, we've missed a lot of the signs in advance. So what we're really interested in is how we identify this cat, how we then quantify the behavior, and then how we use those behaviors to monitor treatment. So we're going to start with how we identify this cat. So we have learned through work over the years that there are 6 activities that can really help us identify those cats with OA. So differentiate between cats with OA and without. And what we're looking at here are the responses of owners whose cats came in for a health screen. They were really being evaluated for OA, but they thought they were coming in for a health screen. And their cats were radiographed. They were categorized as having OA or not. And without the owners knowing what it was that was being evaluated, they were asked to rate their cat's ability to perform a series of activities. And what we're looking at here are the percentage of the cats who were scored as abnormal on those activities. In blue, we have the OA cats, and in orange, we have the non-OA cats. And what we're most interested here are those behaviors that best distinguish between the OA cats and the non-OA cats. So what are those ones where we really see a big difference between those two groups? And what we found was that using these 6 activities, we were really able to categorize cats as OA or not based on whether they were scored as abnormal. So this is running, jumping up, jumping down, climbing up or down stairs, and chasing objects. Some of the activities on the right are ones where we really think about those as being changed with OA also, right? So vocalization on handling, maybe that aggressiveness on handling, spontaneous vocalization or aggression. Those are ones where we certainly do see them change in cats with OA, but there are tons of reasons that cats without OA can have those same behaviors, right? Litter box. We know there's a lot of reasons that cats may have changes in their litter box. And so these ones that are on the right, I think about as ones that we're looking for changes in an individual cat. So a cat who was social and now is not, a cat who tolerated handling and now does not. Those changes are important for these activities on the right or behaviors on the right. On the left, just the fact that they're abnormal indicates that they may have OA pain. Unlike dogs, though, these behaviors are best observed in the home. They're harder for us as veterinarians in the clinic to evaluate. There aren't that many cats that will go out on walks, that will walk up and down and trot in our hallways. At the clinic, it's much more difficult for us to evaluate these at the clinic, so we really have to be engaging with our owners to look for these behaviors at home. So here's another video we're going to see, again, of the greatest cat in the world. And I want you to think about, knowing what those behaviors were, think about what it is that you see, how you see her behaviors change in this video. And for time, I'll talk over it this time rather than watching it twice. So she says, no way, that stool is not a good option for me. Thanks anyway. Looking around for a place to jump down. See the hesitation. And then did you see her reach way down and that really hard landing when she landed? So almost turning so that she can cushion her elbows and land on all 4 feet. So those things change. She still gets down, right? But the way she does it changes. Here's a compilation one. So here we do see a lameness as one of the signs in this cat. Bunny hopping going up the stairs, right? Or they'll lead with one foot, the same foot every time. So leading with one paw. You can certainly appreciate this as abnormal coming downstairs, right? The bunny hopping, the wide base stance in the back. Taking small jumps up rather than one big jump up. And again, using those smaller jumps and some hesitation jumping up, right? So the way that they do these things is more different than whether they do them at all. But without owner engagement, lots of these signs, lots of these behaviors are attributed to aging. People just think their cat is getting old, or they don't notice them until they know what they're looking for. When they do know what they're looking for, though, we know that owners can appreciate these behaviors and that they can appreciate a change in them. So it's really good news. So if you think about why it matters, right? Why do we need to appreciate and address these? Well, pain inherently affects quality of life, right? Pain decreases quality of life, but the manifestations of pain can also affect quality of life in more ways than just the pain itself. If we think about what's important for a cat's environment, that number one is a safe place. We also need to think about their opportunities for play, their positive, predictable social interactions. And with OA, we can see that coping ability decrease. We talked about that earlier, right? That cycle of fear and stress and pain, their ability to cope really goes down. And we have to make modifications in their environment to ensure that they have access to all of these pillars. Because quality of life is more than just the absence of pain. There are many impacts on the quality of life, right? There's the pain itself, but then the mobility impairment, that ability to move smoothly, to get away, to get to places that you want to get to, that affects quality of life. Sickness, other chronic diseases, cognitive decline, anxiety, fear, aggression, and then that environmental piece is so important for their quality of life. So to understand what we need to provide for cats, we need to understand a bit about cat needs, including cat natural history, right? So if we think about cats' time budgets, the way that cats would spend their time, they spend a lot of time sleeping, right? 44% sleeping. And then we add on an additional 25% resting. So a lot of time spent sleeping and resting, which may seem like, okay, well, we don't need to worry so much about that time, except that because of cats' natural history, they need to feel safe in order to be able to get that sleep and get that rest, right? They have to be able to access comfortable, safe spaces. So pain and mobility impairment affect even that sleeping and resting that we think about as being, one of the hallmarks of cat behavior. They would spend 17% of their time hunting. That's a totally different lecture about the way that we feed cats, but we'll talk a little bit about that. They spend some time in travel and grooming, eating, and other. So we think about how is this time budget affected or altered by chronic pain? So thinking about their history, cats are solitary hunters, right? Their social structure is both solitary and community, so what we call flexible social structure. So they are able to live in groups, but they timeshare their resources. So social groups will be able to share some resources, but cats need the ability to have multiple resources and the ability to avoid conflict. People are part of cats' social structure. So people, their owners, are really important, and making sure that we preserve access to that quality time. And cats use scent for communication, right? That's, again, one of those pillars for a healthy environment. So cats are mid-level predators, right? Mesopredators. They are not the top of the food chain, but they're also not the bottom. So they show some behavioral features of both predator and prey, right? So they are small, hyper-carnivorous predators that we keep inside our homes, which means we really have to provide for the needs of these small predators. They have that flexible social structure. As I said, they can live in groups, particularly if the resources are concentrated. So some of the earliest work on this looked at barn cat and barn cat behavior and how they would concentrate if the resources were concentrated. So one big milk bowl, how would they manage that? Versus if the resources are dispersed and how they're able to live a more solitary life. So cats have a really remarkable ability to flex that social structuring. They timeshare their resources. Again, this is a system of communication that's designed to avoid conflict. Cats are very conflict averse. They use scent marking, they use other communications, body posturing, in order to avoid conflict, right? They actually don't have that much face-to-face posturing. They use a lot of more remote signaling in order to avoid spaces. So a lot of their scent marking says, I was here about when, right? We know they can detect the freshness of scents, of scent marks that are left. And they use vertical space as well. So we'll talk a little bit about the importance of that. But cats will do this amazing dance to avoid any conflict. This is a video of a cat is actually shooting down into a storm drain in the US. So what we see is cats using these storm drains to move around their environment. But these storm drains may be only a foot in diameter. And so what we see is this investigating of the scent that was left by the cat before, leaving your own scent as you go in. So helping maneuver that space to avoid conflict in a pretty tight space if they were to run into one another. Okay, social interactions with people are important. People will talk about cats being solitary or being somewhat aloof, but actually there's pretty good evidence, both just from our experiences with cats, but even objective evidence looking at activity, that their activity is altered by our activity. So they adopt a pattern that's very similar to ours. What we're looking at over here on the right is an activity report from cats. So if we look at across the 24 hours of the day, on weekdays, we see these two peaks, right, around 6, 7 a.m. when people get up, and then again in the evening when people come home from work, and then dipping down and remaining low overnight. Cats are crepuscular by nature, right, awake at dawn and dusk, but they actually shift to a fairly diurnal pattern when they live inside with humans. So the pattern of indoor cats is very different from the pattern of outdoor cats. We look at their weekends, they do kind of like us, right? Kind of a shift to the right. So waking up a little bit lower and sort of a more gradual pattern of activity across the day. And then as mentioned, cats use scent for communication. They leave scent marks in order to negotiate around their space. They investigate scent marks in order to know who was there when. So it's important for them to have that ability to stand up and to scratch, right? To leave those scents there, to condition their claws. Mobility and freedom from pain is important in each of these pieces of cat quality of life. And because we keep these cats, at least in the United States, indoors most of the time, and in the UK and EU, they're allowed outside much more often. I think that helps fill a lot of their behavioral needs. When we keep them indoors, as we do here, they depend on us to meet their needs. So lack of activity and enrichment can lead to a variety of health and behavioral issues. So we can see obesity, inappropriate play, boredom and frustration, and the potential for behavior problems. And certainly having cats go outdoors has other dangers inherent in it or other environmental effects, but it does meet some of those behavioral needs that are otherwise difficult to meet when we keep them indoors. So the importance of 3D space is really important for cats. So we know particularly in cats who are kept indoors that 3D space helps them negotiate with the other cats in the home, right? If cats are asked to live in a home with other cats, they don't really get to pick which other cats live in the home, right? We do. And so we're asking cats to do something that maybe not that natural for them. And often in the way that we introduce them, it's definitely not natural for them. So it's pretty remarkable that we have as few problems as we do. But one of the reasons that we have cats able to do this is that cats are very effective users of 3D space. So they can increase the amount of space in which to disperse in by going high, right? So we know that in cats who are living in colonies, the more increased 3D space they have, the fewer unfriendly, agonistic encounters we'll see. So the fewer posturing, the fewer fights that we'll see. So cats, when they become kind of more land lovers, when they seem to be on the ground more often than using that 3D space, that may be because of discomfort or pain. And we also know that when cats are treated with an effective analgesic, they will resume their use of vertical space. It's one of the things that we saw over and over again in trials, that owners were really surprised by what their cats both wanted to do still and could do when they were treated with an analgesic. So that vertical space is really important to cats. And we have to think about, when we have cats with degenerative joint disease and OA, what accommodations do we have to make to preserve access? Because it's not just the treatment of the pain. We need to think about what are the ways that we make sure that they can still access those spaces. Because those spaces are safe spaces. When cats are less able to maneuver as well, less able to jump up, less able to quickly go up the stairs, their ability to get away may be compromised, right? Whether that's from another cat or from a child who's toddling after them or from the new puppy, that ability to get away is compromised, and that increases stress, which then feeds back into that stress, fear, and pain cycle. So cats with OA pain need consistent access to safe and comfortable spaces. So we've thought about what cat needs are, right? What shapes those needs, what's important for cats. But now if we go back and think about, okay, how do we actually identify this cat? Again, what we see in the clinic may be very different from what they're doing at home. It's really hard for us to see cats at their very best. And certainly their movement around our rooms is not the way that they're going to move normally at home. So that owner engagement is really crucial. They know their cat's behavior and they notice changes earlier. It's that they may dismiss those changes as slowing down or normal aging if they don't know that they're associated with a pain and with a painful disease. So that means that we have to shift our conversation with owners in order to be able to identify these cats. Because we do know from research that learning about OA and OA pain motivates action among owners. They don't want their cats to be in pain, right? They can detect behavioral changes in their cats. We've seen this over and over again in our trials. We know that they can see them if they know what they're looking for. We know that they can see the ones that improve and the ones that don't improve when analgesic treatment is given. They don't want their cats to be in pain. So once they recognize that there might be pain there, they want to do something. But the gap is that understanding that the changes that they're seeing may indicate disease. And that's the important piece that we really need to engage owners with. And this means that we need a shift in our language, because when we ask about pain, what owners are imagining is very different from what we're imagining, right? So if we say, do you think your cat has any pain? The owners may say, oh, no, I don't think she has pain. But that's because what they're picturing is a cat in more acute pain. They think about vocalization, about squinting eyes, about signs of pretty acute pain, when what we're thinking about really is more like this cat that's sitting in this owner's lap who has difficulty jumping up or going up and down the stairs. So when we say pain, we're talking about two very different things. And so instead, we have to be asking about those particular behaviors, not just about pain. Because when we say pain, what owners think about are these very extreme things. So changes in feeding behavior, avoidance of bright areas, vocalization, eyes closed, right? So signs that if you can imagine a cat showing those signs all the time, that would be awful. They're missing a lot of the chronic pain signs because they don't know that that's what they're supposed to be looking for. So we have to help shift their awareness toward these less extreme behavioral changes that are still indicative of really painful disease. So how can we do that? Well, there's some tools out there. So this is a tool that's the cat arthritis pain checklist. This is built off of those 6 activities I showed you toward the beginning of the talk. So there's ones that we know are affected in cats with OA and with OA pain. So climbing up the stairs, down the stairs, chasing objects, jumping up, jumping down, and running. And What is available are some animations I'll show you in a second, so that compare a cat with joint disease and without, because those comparisons can be really powerful for owners. Joint disease in cats and dogs and humans is a chronic and progressive disease. So it can be difficult for people to remember what normal should look like, and in appreciating what's going on with their cat. And so comparisons are available in these animations. And then there are also incorporated some questions about quality of life. So about energy and enthusiasm, activity and comfort, happiness and contentment. So based on Jackie Reed's work. And then again, looks at some of those behaviors that were on the right of that chart that look at changes in an individual cat. So not whether or not it's abnormal, but whether it's changed in your cat, personality and sociability, litter box use, and hiding more. So these are the activities, again, more close up. So climbing up the stairs, down the stairs, moving objects, jumping up, jumping down, and running. And those comparisons, the reason that we use those can be really powerful for people to be able to see, oh, that's what a normal cat should look like. That is not what my cat looks like. So I'm going to show you two videos. Again, one we've already seen. The same space, the same kitchen, the same height, how one cat jumps and how the other cat jumps. So here's, again, this video that we saw of Ursa. So that hesitation gives you another chance to watch that landing. So watch her landing. So reaching way down and then landing, first forelimbs and then very quickly hind limbs. Now let's watch a normal cat. You see the box? Beautiful jump up. Go. Here. So we see that more arching out, jump down without any hesitation. So seeing those comparisons can be really powerful for people. And here we've got two different cats. The animations show two different cats, but watching a video of their cat over time after an analgesic treatment has been given or over the years can really help people to appreciate what the changes are in their cat. Okay. So where are we? What do we have? We've got an appreciation for the effects of pain in cats and the behaviors that are changed, those behaviors that we can use to identify and monitor OA pain. And we know that owners are motivated to provide pain control for their cats. They want to treat them once they understand that there is pain there. So what are we missing? Treatment options. So how do we treat and manage these cats? If we think about our primary goal being restoring quality of life, that means that we have to think about all of those pillars that are important, not just the treatment of the pain itself, but the lifestyle changes, the behavior or the environmental changes that we can make, pharmacological interventions, and those non-pharmacological interventions to help these cats. So some of the lifestyle changes that we can make are to the environment. So modifying the environment to make sure that they still have access to all of those things that we identified as being important to their quality of life. So litter boxes being one of the things that we can alter for them. So making it so that there's a low entry for the litter boxes, making sure that they're in their core areas. So where cats spend 75% of their time, when we evaluate that when they're young, that may be different from where they're spending 75% of their time when they're older. And so we need to reevaluate that and make sure that if we have litter boxes, that they are in that core area and that cats can get in and out of them. The covered box or the deeper box on the left can be helpful for some cats. We see cats who can get into the litter box and then posture, but then just can't hold that posture the whole time. And so will start to stand up as they're eliminating. Looks like they're eliminating out of the back, or they may just not be able to hold that posture the full time. So these deeper boxes can be helpful for those cats, but still making sure that they have an easy, low entry in. Making sure that we have comfortable places for them to rest. Heated beds are amazing for older cats. and making sure, again, that those are in the areas where they're spending time and are accessible for them. And if we look at what are those preferred areas for cats, what are the places that are really important for my cat's quality of life, can I make sure they can still get there? Should I use stairs? Can I position something to make it so that my cat can still get up and away or into that preferred resting area? Our supportive lifestyle changes, so weight loss if necessary, which for many cats in the US is, which can be difficult in cats, controlled exercise, and making sure they're still moving, that they're getting some movement, whether that's using food puzzles or food toys or tossing food treats or playing with them. Many of these cats will still want to play. People will say, well, I don't think he likes to play anymore, but they've really stopped trying. So we have to encourage people to try playing with their cats again. Grooming as a supportive care. I really don't think cats like to look unkempt. I think it's bad for their sort of self-esteem as cats. And so sometimes if they're unable to reach or properly groom an area, we need to give them some assistance with their grooming. So again, some of the ways that we can provide enrichment for them and really think about filling some of that time budget that would be spent hunting. So delivering food in innovative ways using either commercially available food toys or just make your own ones. This is a toilet paper roll. This is an egg carton. So making ways for cats to interact with their food and get more activity. And again, thinking about those social interactions that are important as one of cats' pillars of quality of life. So making sure that they still have time and that they can get to those places, right? If people think, well, he's just not visiting me as much anymore, we need to make sure that he still can get up onto the couch, right? When we think about what our other interventions are, right? So some of our pharmacologic interventions, obviously, kind of our mainstay is NSAIDs. We use a lot of NSAIDs for cats with OA and OA pain. A lot of nutraceuticals are used, some joint diets, and gabapentin is another one that's really commonly used. I think probably all of you can pick out the ones that you're using from this list or maybe others. Tricyclic antidepressants like amitriptyline used a lot less, I think, than some of these others, but the big ones really being NSAIDs, gabapentin, and nutraceuticals and joint diets. But all of these being things that are available to us as part of our toolbox. When we look at those pharmacologic interventions, so we have approved therapies. So these are actually not in the United States. In the US, we have no approved therapies for treatment in cats, but in other areas, we have NSAIDs, so meloxicam and robenacoxib, which are approved, and frunevetmab, which is Solensia, has received marketing authorization in the EU, the UK, and Switzerland. And when we look at what is backed by evidence-based literature, the NSAIDs and diet optimization are really some of the proven therapies. And I'll show you some of the work on frunevetmab as well. Okay, so if we remember our multidisciplinary patient, we've got our cat who may have OA and OA pain, which is critical for us to treat and manage with our lifestyle and environmental changes and pharmacologic management. But we have all these other pieces as well. This cat may be receiving other medications or other therapies. And so we have to really think about how we balance our treatments and the human and cat bond and how we maintain that human and cat bond. So we know that there's a limited number of pills that cats can be given. And some cats take them much better than others. One of the things that I think is really important for us is to be talking with owners about how to administer pills or liquids, asking them about what's best for their cat. So we kind of assume that cat owners prefer liquids, but actually probably about 50% of them prefer pills. Their cats are just easier to give pills to, but also really talking with them about, not giving them a bottle and sending them out the door, making sure that they understand about how to give it. I'm going to show a video of a cat who I promise when this cat was younger, we thought, oh, I hope this cat never gets really sick because he was so difficult for everybody, including his owner, to manage. But she was such a dedicated owner and caregiver, and she worked with this cat so that when he did develop chronic disease, she was able to both pill him and give him sub-Q fluids. So this is just a little bit of baby food on a pill dispenser. He's just able to take it. I mean, he spit it out that time, but he takes it again.
Spits it out, or it's very rare. I get stage fright.
So when we're using multiple medications, we really have to think about that balance and make sure that owners are prepared for how to manage their cats. But it may be that we also want to think about some of the different ways that we can administer medications to cats. So when we think about the treatments that we use, the NSAIDs, and what those target, we know that's targeting prostaglandin, right? We're all pretty familiar with and comfortable with prostaglandins and their role in pain perception and pain sensitization. The one that I want to talk to you a little bit about is NGF and its receptor TrkA. So NGF is responsible during development for nerve growth. It's nerve growth factor. So it is important in the development of the nervous system. However, in the adult, its role switches and its primary role is pronociceptive. So when binding with its receptor TrkA, it leads to neuronal sensitization. So it really amps up the system and has a role in pain sensitization in cats. And this is a great article that really reviews anti-nerve growth factor monoclonal antibodies for the use in pain in dogs and cats. It's open access, so I encourage you to read it as a great review of nerve growth factors role in pain and how we can target nerve growth factor, because there's several ways that we can do that to remove nerve growth factor from the system or decrease it in the system when it's increased in these arthritic patients. So we can remove the free NGF, and that's primarily these anti-NGF monoclonal antibodies. We can prevent NGF from binding to TrkA, its receptor, and we can prevent TrkA activation. But by far the most common is this removal via the anti-nerve growth factor monoclonal antibodies. So again, binding that free NGF and then removing it from the system. And monoclonal antibodies are being increasingly used in veterinary medicine. They are certainly also used in human medicine. There are several benefits of monoclonal antibodies, including their long duration of action. So in cats, you can imagine that having a treatment that only has to be given once every 4 weeks or more, or longer, might be a benefit for cats. They're injectable, they have a low risk of toxicity, and they're highly specific, so they do not cross the blood-brain barrier. And there are several ways to make monoclonal antibodies. Felinized and caninized monoclonal antibodies, or fully feline and fully canine monoclonal antibodies, are what's most commonly used in veterinary medicine. So 2, and actually now 3 studies have come out looking at the use of feline anti-nerve growth factor monoclonal antibody. In the proof of concept study, which we did at NC State, we had 34 cats, 23 who received frunevetmab, the anti-nerve growth factor antibody, and 11 on placebo. They had 1 injection that was given sub-Q and 7 weeks of follow-up using activity monitors and owner questionnaires. And then there was a pilot field study that had 126 cats, so increased the number of sites and the number of cats, with 85 receiving the anti-nerve growth factor antibody and 41 on placebo. This time they had 2 injections, which were either given, the first one was given sub-Q or IV, and the second one was given sub-Q 4 weeks apart, and again with owner questionnaires and activity monitors, and both showed a positive effect for frunevetmab treatment in the management of chronic pain in cats. So saw improvements in these activity monitors and owner questionnaires. But what can we do right now? Well, if you are in the EU or Switzerland or the UK, you have Silencia as another option. But I also want to make sure that we have this available for you. I have to move my little picture in case you want to scan the QR code. This is a great article that talks about the tools that are available for clinicians and for pet owners now, and some of the treatments that can be used. But certainly other treatments are on the horizon or may be available in your area. All right, so our key takeaways are that really the behavior, I mean, as a behaviorist, I'm somewhat biased, but I truly believe that behaviors that are impacted by chronic pain are important ones for quality of life for cats, and that behavior is the best way for us to assess and to manage treatment and progression monitoring in cats. These are best assessed in the home, which means that we have to partner with our owners. Move my little picture again. Owners who are made aware of what they should be looking for are able to watch for these abnormal behaviors. They're able to identify them. They are able to monitor how they change in response to a treatment, and they are motivated to treat their cats. And new treatment options offer promise for the relief of OA pain in cats. And with that, I can take any questions.
Well, I'm sure you'll agree that's an absolutely fantastic presentation. Before we move on to questions, though, we do have also with us Dr. Edwina Gildea, from Zoetis, and she is going to give us a short presentation on Silencia. So we'll do that, and then we'll have both Dr. Gruen and Dr. Gildea available for questions. So any questions at all that you have on either the behavioural side or on Silencia, then don't forget to type those into the questions. Into the chat box, which is at your bottom of your screen. So this is your last chance now to ask any questions. Over to Dr. Gildea.
I'm delighted to have the opportunity to follow Dr. Gruen's excellent talk and introduce you to Silencia, the first and only antibody therapy for cats. My name is Edwina Gildea, and I'm the UK Companion Animal Veterinary Lead. So as I mentioned, Silencia is the first and only antibody therapy for cats with osteoarthritis. It alleviates pain for an entire month and has a proven safety profile. So let's learn a little bit more about what antibodies are. Monoclonal antibodies are highly specific immune system proteins that target and neutralize molecules involved in disease. They function like naturally occurring antibodies, and as such, they are eliminated via the normal protein degradation pathways with minimal involvement of the liver or kidneys. In relation to Silencia, the target is nerve growth factor. So what does nerve growth factor do, or how does it work? Well, in the disease of osteoarthritis, nerve growth factor, by binding to receptors on neurons and immune cells, results in increased pain, the release of pro-inflammatory mediators and more NGF, as well as neurogenic inflammation. In osteoarthritic joints, nerve growth factor is found to be elevated. So let's look at Silencia as a product itself. So we know that it alleviates osteoarthritis pain, as mentioned, for an entire month. It's given through a single subcutaneous injection, and in the studies, it showed a treatment effect that increased mobility and decreased pain. Also, in laboratory studies, Silencia significantly reduced pain in 6 days. We know also reducing pain helps to improve quality of life. So this is a reflection of the actual pivotal study. How we actually assessed success was using the client-specific outcomes measure tool. And this tool is used to assess osteoarthritis pain and pain treatment efficacy. It measures the impact of pain on an individual cat, including their physical activity level, sociability, and quality of life. The graph here represents the results. The study ran for 3 months, and here you can actually see the output based on the 3 different assessment points. So day 28, 67% of cats involved in the study had reached treatment success. You'll note that 52% of the placebo group, which is reflected by the grey line, had also reached treatment success, and we can see that line increasing over time. It's actually known, and something that Dr. Gruen has well studied, that the placebo effect is remarkably high in analgesic clinical trials for cats. If we look back at the output for the Silencia group, we can see at the first and the second time point in relation to assessment at day 28 and day 56, the improvement went from 67 to 76% in relation to treatment success, and on to 77% at day 84. The asterisk reflects that at the first and the second assessment points, there was a statistical significant difference between that of Silencia and that of the placebo group. However, on the third assessment point, the difference was not statistically significantly different. This was reflected by the actual increase in the placebo as opposed to any decline in the Silencia group. Further studies have been carried out in relation to frunevetmab, and this is one of the earlier studies. This actually looked at the mobility of cats using activity monitors. And within this study, the activity monitors were applied to the cats. The cats were therefore allowed to get used to the activity monitor for a period of 2 weeks before the trial actually started. So at 2 weeks after applying the activity monitors, frunevetmab was administered, as was a placebo. And you can see the results reflected in the pink line reflecting the Silencia group or frunevetmab group, and the grey line reflecting that of the placebo group. It's important to also note that the dose of frunevetmab within this study was either 0.4 mg per kg or 0.8 mg per kg, which is actually different to the licensed dose, which is actually significantly higher, which is 1 to 2.8 mg per kg. However, if we look at the difference between the placebo group and that of Silencia, there's a 12.9% greater activity within the Silencia group than the placebo group over the first 3 weeks. So pulling it all together, we know that Silencia acts like naturally produced antibodies and therefore is processed in the same way as we mentioned. And in relation to renal disease, cats with IRIS stage 1 and 2 were actually part of the studies, and it was well tolerated in that group, and there were no adverse events reported within this group. IRIS stage 3 and 4 weren't part of the study, and this is because cats with IRIS stage 3 and 4 would be clinically unwell and actually wouldn't be study candidates. Within the SPC, there were adverse events reported, which was focal skin reactions. So it's noted that focal skin reactions, for example, pruritus, dermatitis, and alopecia, occurred commonly in studies. And commonly is noted as more than 1, but less than 10 in 100 animals treated. So what does that actually mean? How serious are these skin reactions? Because that is what obviously us as vets and pet owners will want to know. So to put a figure on it, 32 cats within the studies actually did report a focal skin reaction. Out of that, 13 of those cats required no treatment at all, and the remaining 19 had standard medical care and the skin reaction resolved. In most cases, the skin condition had some primary nidus, for example, traumatic injury or flea infestation, or actually had a history of pre-existing skin condition, for example, allergic dermatitis. It's also worth noting that repeated administrations did not increase the incidence. In relation to the safety, margin of safety studies are carried out on all products, and the same as will have happened with Silencia or frunevetmab. So as I mentioned, the dose for Silencia is 1 to 2.8 mg per kg. In margin of safety studies, we give excess product to pressure test the safety profile of it. And in this case, Silencia was administered at 5 times that upper limit. So basically 14 mg per kg was given every month for 6 months with no adverse events noted. In relation to contraindications on the SPC, it's important to reflect what that is. So Silencia should not be administered to cats less than 12 months of age or under 2.5 kilos body weight. We know that nerve growth factor is important in the developing fetus and the newborn, so it's important that we don't give an anti-NGF in relation to these early ages. The 2.5 kilos of body weight is there because there weren't any cats weighing less than that within the studies. Also noted in the contraindications is not to administer where you know there's a hypersensitivity to the active substance or any of the excipients. Also, it's not intended for breeding or animals that are pregnant or lactating. This naturally transpires in relation to a nerve growth factor and its importance in the developing fetus for those that are pregnant or lactating. I also want to point out in relation to the special precautions section of the SPC, that pregnant women trying to conceive, and breastfeeding women should take extreme care to avoid accidental self-injection. Within the studies, there were no known interactions with other medicinal products, so medications allowed during the clinical studies were vaccines, parasiticides, antimicrobials, and also nutritional supplements. Looking at how we're going to use the product, on the right-hand side here, you can see the picture of the actual Silencia box. Within that box, you'll have 2 vials, and within those vials, you find a ml of Silencia or frunevetmab being the active ingredient. The dose, as I mentioned previously, is 1 to 2.8 mg per kg. So that transpires to a 1 ml vial treating cats 2.5 to 7 kilo body weight. For cats that are greater than 7 kilos, so those going from 7 to 14 kilos, would be administered 2 mls. It's also important to recognize how to handle the product. It is an antibody, so therefore managing it like you probably would an insulin. So avoid excessive shaking or foaming of the solution. If you do want to administer other medications, for example, in this case, a vaccine, you can actually administer at the same time as Silencia, but it's actually recommended to administer at a different site to where you're actually administering the Silencia. Also, from a storage point of view, it should be stored in a fridge, and once opened, the entire contents of the vial used, or if there is anything remaining, to be disposed. There is no preservative in these type of products, and they are single approach vials. Before we conclude, I want to bring your attention to a webinar that Zoetis will be providing, not on the topic of osteoarthritis, but it is around cats and something that you may be interested in. It's on November the 16th at 6:30 Greenwich Mean Time. If you're interested, please feel free to reach out to any of your local Zoetis representatives who will be able to pass you on the invite to attend. Thank you for your time, and I welcome any questions that you may have.
Thank you so much to both Dr. Gruen and Dr. Gilday for some fantastic presentations. I think, as Dr. Gruen, you said at the beginning, that cats certainly can be tricky to assess under any circumstances, really. So it's really, really great to learn about some of those sometimes subtle signs that they show, which obviously not only help us as veterinary professionals, but also for that there's something we can share with the cat caregivers as well to help educate them too. So it's absolutely fantastic. And of course, it's also really great to hear about all the tools we have available, not only in terms of the medication, but also the whole environmental aspect as well. So thank you both very much for your presentations. We do have quite a few questions, so I might have to be selective with them, but are you both okay to go through some of those now?
Yes, definitely. Thank you very much. It's Edwina here. So happy
Excellent. Brilliant. And Dr. Gruen, do we still have you? Excellent.
Yes.
Brilliant. Just checking that we're still all present and correct. Okay, so I think we'll start with, obviously we started this evening with the kind of the behaviour side of things. So we'll choose some questions on that initially before going on to the medication side. So Dr. Gruen, you said quite near the beginning, I think it was, about behaviour is probably the best way actually to assess pain in cats. So what, if any, and the answer may be that none, but if any, what other diagnostics would you like to do ideally before starting a medication treatment? And I think particularly here we're thinking about maybe practitioners that are in first opinion practice, so they might not have all the fancy kit available that we might have in referral practice. But, is there something that you would like to do, or would you just go straight in with medication side of things?
Oh, that's a great question. And, as a behaviorist, I have to try very hard to draw attention to the behavior side, but certainly we do still do our evaluation in the clinic. We just don't get to see the types of behaviors and movements in the clinic that we can appreciate from home. So we're more and more asking owners to bring video in from home so that we can look at that in the clinic, in sort of looking at very specific behaviors, those ones from the checklist, for example, so that we're not looking at hours of video, but we can get small clips of video. But in the clinic, we've also really tried to focus people on their observation. So using the types of things that cats will do in the clinic. So we often are not very successful at getting them to jump up, but they certainly will jump down for us, so we can watch how they jump down. We can watch them walk across the room if we need to. Sometimes we'll put the carrier at the other end of the room or the owner at the other end of the room so that they'll walk toward them. So just taking those moments that we can, and then also doing our orthopedic exams, our hands-on exams, as a piece of that. So we really think the observation side, looking at the cat's conformation, looking at how they're holding themselves, looking for that, looking from above and looking down and seeing, do we see sort of a torpedo shape as they kind of get thinner toward the back end. But then using those clues to help us look for where we should target our orthopedic exam if we have a cat who may not tolerate as long an exam as we'd like to do. So if we see cats who are reaching way down before jumping down, I think in vet school, at least for me, we were taught, do the most painful area last. With cats, we probably move that up a little bit if it seems like they're not going to tolerate the entire examination. So we might then start with the forelimbs, maybe the one we don't think is as painful, and then the one that we do. But also, we do use radiographs. We certainly use them to make sure that there's not something more proliferative or lytic, but also to confirm arthritis. But as I say that, we err on the side of believing the cat. So if the cat seems quite painful, but we don't see signs of radiographic OA, we will err on the side of believing the cat. But certainly those other diagnostics are important. And we also always do our lab work so that we can make sure that we choose an appropriate medication, or at least we have a baseline from which to evaluate after we've given a medication or treatment. That's a great question.
Excellent. Thank you very much. Yeah, it's great. And I guess, a lot of these cats will be on the older side as well, so we may well have other kind of comorbidities going on at the same time, mightn't we, that we might not otherwise have picked up,
Yes.
On bloods, for example. So absolutely brilliant. Okay, I've got another fantastic question that's coming, which I think probably a lot of us can relate to, actually. So this is a brilliant question from Rebecca. Now, she is asking how we approach a conversation with an owner that uses their own experience with osteoarthritis. So the example is that she recently had an owner who has osteoarthritis herself, and she is taking her experience in how that affects her mobility and is refusing medication for the cat because she doesn't feel that the pain is severe enough to justify any side effects of medication. So I think this is where anthropomorphism comes in, isn't it? So how do we deal with owners? Because obviously a lot of people suffer from this as well, and I myself have it very slightly, and I guess from my point of view, I don't take any medication because I can manage it. But how do we explain to owners that it's different for cats?
That's also a great question. I think we see both sides of that. We see some people for whom that motivates treatment, and then we see others for whom that is a detractor, particularly if they have arthritis in a hand or something that's not weight bearing, so it doesn't have quite the same impact on their mobility. What we will often try to do is have people do at least a short pain trial and really look at what changes. Maybe your cat doesn't change that much. Maybe it isn't actually impacting them yet as much as it might later. But we really advocate short-term or one-time pain trials so that they can take a look, because I think owners are they are often able to see that improvement. And we had so many people who were so surprised by what their cats wanted to do when they were free from pain. They just did not appreciate that their cat still even wanted to do any of those things. And I think when they see that, it's quite powerful. For many, for some it won't be, but for many, it's quite powerful to see what their cat had stopped doing because of pain that then they start doing again. And that, I think, is really kind of the proof in the pudding for many owners. It won't obviously convince everyone, but it does often help.
Excellent. Yeah, fantastic. Yeah, it is difficult. As you often we think sometimes cats are difficult, but sometimes it's the people that can be slightly more difficult, isn't it? Absolutely. Brilliant. Yeah, great answer, and that's something. And I think as well as having had older cats myself as well, you see them every day. You don't necessarily notice those subtle changes, but then, like you say, if they suddenly then change and I can't remember when he last did that or what have you. So if they suddenly then see the cat jumping up and not using a step, for example, like I say, that is when probably the penny drops and they just didn't realise that behaviour had changed, because the cat was ultimately still achieving the same thing but in a slightly different way, as you mentioned in your presentation. So that's fantastic. Thank you. Now let's have a look. I had another question. Now it's from Andrew, who's actually asked the question. Is for yourself, Dr. Gruen, again. But Dr. Gilday may be able to help us on this as well a little bit. So Andrew is saying that Silencia is wonderful, which we like to hear, and she's been using it for quite a while. But she's asking whether you would recommend to start either muscle relaxants or antidepressants when you first start using Silencia, or if you're using non-steroidals as well. Would you use those kind of initially until the medication for the pain kind of kicks in as such? Have you ever used any combinations like that at all?
Yes, we're hearing, and I know this is not necessarily what is supposed to happen, but we are hearing that people are using a few days worth of NSAIDs during that transition before it sort of kicks in. Antidepressants have a quite a long lag time as well, so that might not be my first choice, but gabapentin is often used as, something that could be used more quickly during those first few days. I don't have as much experience myself with muscle relaxants, but I think anything that is helpful in those first few days would be fine. In many cases, cats have not been treated for so long that a few extra days isn't we want them to be started on pain relief as soon as possible, but in the sort of scope of things, it probably makes not too much difference. But we are hearing about people putting in place gabapentin or something else during that kind of initial 4 or 5 days.
Brilliant, lovely, thank you. Dr. Gilday, any comments on that at all in terms of when people start Silencia, whether you're aware of that? Other people using other things?
I think it's quite a mixed approach, if I'm honest. We obviously flagged that in the studies that it's a 6-day onset of efficacy, and that period, the vet can actually add in other medication. There's nothing that's contraindicated. I think where people have held back a little bit is they haven't been treating significantly with other medications. I think that's what we find in relation to diagnosis as well. The diagnosis is low and the treatment rate is low. So their confidence, I guess, around what treatments to use and also what to use together with another new medication is resulting in people maybe just choosing one treatment. But equally, if you're confident with other medications and have used them, there's no contraindication with using them alongside Silencia. So as long as we're ensuring that cat is pain-free is really what our aim is. So.
Excellent. Okay, now, as you can imagine, we have quite a lot of questions on Silencia. It obviously, being fairly new and people wanting to know more about it. So I'm just going to pick out a few that might be sort of more useful to everyone. There's a good question here actually about dosing. So if you have an obese cat, do we dose to the actual weight or to their ideal weight?
In relation to it is a protein, so it's not metabolized. It is catabolized like a normal antibody. So I would actually treat to the body weight, and again I'll open up to Dr. Gruen and her opinions on that. The dosing it's 1 ml for a cat up to, as I covered, from 2.5 up to 7 kilos. Mm-hmm. If you're then talking about a larger cat, which I guess the question is coming from 7 to 14, you do give another full ml. So you don't point dose in these cases. So you are actually getting a range across that weight of cat. So I would still continue with the 2 ml if the cat is from 7 to 14 kilos, as opposed to trying to dose, point dose, because the additional product that may be left, you have to discard anyway. So it's not going to be detrimental. It's still within all the safety and the margin safety studies to do that. So I guess if there's any cats greater than 14, would be really interested to hear about that, but it's not a common challenge in the UK.
Okay. Excellent. You mentioned Dr. Gruen there. Do you have any experience in obese cats?
We did in the trial, but again, we at that point were dosing to weight in the very initial trial. In the later trials, it was again that range. So I don't have really any additional comments. I think it was covered quite well.
Excellent, thank you very much. Okay, let's have a look. So I'm just going to pick out a few because I appreciate both your times, obviously for the presentation and for the Q&A. So I don't want to keep you too long, and I also appreciate we have people from all over the globe listening this evening as well. So it is, either late evening, early morning, midday, depending on where you are, really. So we will try and wrap it up soon. I'm just going to pick some good ones out here. Okay. Good question about pain scoring charts. So, Dr. Gruen, you had the lovely charts, which was for the, up and down the stairs, jumping up and down, that kind of thing. But if we're using one of the pain score charts that are available to us as veterinary professionals, if we're talking about osteoarthritis in particular, is there any one that is better than another, or just personal preference, really?
I think that it is to some extent personal preference, although the more that can be done towards standardization and, making sure that multiple doctors across a clinic, for example, are using the same system so that when someone asks an owner about a scale, the answer they're getting back would be comparable, as opposed to, asking it a different way every time. Many of the pain scales are acute pain scales, so it's important to look for what type of pain they're addressing. For example, the feline grimace scale is an absolutely amazing scale, but probably not appropriate for arthritis. Mm-hmm. So, we have the FMPI, we have now the FMPI short form that we use quite often, but then there are others, certainly the MyCat or the, it just escaped me, but there are other ones that are great. I think just coming to a decision across a practice or a clinic or a group is a great idea so that you can really track a cat over time.
Excellent, thank you very much. Okay, we'll just go back to Dr. Gilday about Solensia, because there's lots of questions. We do have some resources in the resources tab, surprisingly enough, which will tell you a lot more about Solensia. But just very quickly, there's a few questions about how long does it last, how long can you use it for, as in long term, and also about comorbidity. So the particular question here is cats with CKD, but I guess, looking at other conditions that older cats may have at the same time. How can we use Solensia in those circumstances?
Yeah, no problem. So first of all, it does last. It's providing pain relief for a month. So that will be important to ensure you go back every month. And not kind of go over the period, because we know it's difficult to assess pain, and therefore we can't necessarily truly spot the signs. Therefore, we know to stick to what the evidence, what the studies have shown us, and to use that monthly. There is no limit to how long you can actually use the product. So that's great. That in a way, the longer we use it for the cat, the more pain relief it's getting, and the concept of supporting it live longer and live happily or in a better quality of life. So there is no limitation on how long you can use it. In relation to other comorbidities, obviously the key thing, and one of the common challenges in cats as they get older also, is the potential of chronic renal disease. Now, with the studies, cats that were part of the studies had, in some cases, IRA stage 1 and 2 chronic renal disease. There were no adverse events in those group of cats. There were no changes in relation to the renal parameters in those cats either. So in relation to chronic renal disease in stage 1 and 2, there were no concerns. Stage 3 and 4, they were just not part of the studies. So what we say in those cases is it's a risk benefit. In those cases, you need to gauge any perceived risk versus the benefit. There is no evidence to show that they would be worse off. It's just they weren't part of the study, because clinically they would be unwell and wouldn't be ideal study candidates. In addition to other conditions that you're treating and the medications that go alongside that. Because Solensia, which is Brunevetmab, it's a monoclonal antibody, and as such, you're not having to, or the cat's not having to metabolize it like it does other medications. So it's catabolized like just naturally occurring antibodies. So it's not putting further pressure on the liver or the kidneys. And indeed, it's not, in a way, competing for some of those enzymes that metabolize traditional pharmaceuticals. So in that relation, there isn't any concerns, and there's no contraindications in relation to any specific diseases or specific medications.
Excellent. That's absolutely fantastic. And I'm gonna call it a day there, because we could be here for a long time, I think, with all the questions. But I think that gives us a really good overview. And like I say, we have got some materials about Solensia in the resources section, so you will hopefully find any other unanswered questions in there as well. So I just want to say, obviously, a huge thank you to both Dr. Gruen for a fantastic presentation with lots of useful information for us to take back to practice, and of course to Dr. Gilday for insights into monoclonal antibodies and Solensia, and finally I think as well to Zoetis for very kindly sponsoring this session, which means that we can make it available to kind of all veterinary professionals. So thank you, and thank you both this evening for your time as well, and particularly for the Q&A, because it's always nice just to wrap up a few loose ends and any questions that people may have. So I really do appreciate that. So don't forget, everyone, that we are recording this session. So as soon as we finish, I'll work a little bit of magic, and it will be available to watch again on this same link, so you can watch over and over as many times as you want. And of course, your certificates and the notes and all of the bonus materials from Zoetis will remain available as well. So please do take the time to have a look at the information provided in the resources section for you. So we're going to call it a day. Finally, I think also a big thank you, of course, to everyone who has joined us. Lots of people from all over the globe, and it's really great to see you all joining us and participating with all your questions as well. So thank you very much. I hope that you enjoyed it and you're inspired to put some of what you've learned today into practice when you're next back into the clinic. So thank you once again, everyone, and goodbye.
Thank you.
Thank you.